So again, welcome today to our Long-Term Care Options presentation presented by our community partners, Stellar Senior Housing Experts with Corey Nelson, Wesley Morrow, and Marla Ivey. Thank you guys so much for giving us your time today.
Thank you for having us, Denise. So yeah, thank you everyone for joining us. I'm Corey Nelson, the owner of Stellar Senior Housing Experts. We've been here in business in Albuquerque for almost 10 years. And with me, I will let them introduce themselves.
I'm Wesley Morrow, partner with Stellar Senior Housing Experts.
Hello, I'm Marla Ivey, transition care specialist for Stellar Senior Housing Experts.
Thank you everyone for joining us today. Let's talk about long-term care options and what exactly you should consider. For example, when is it time for additional care? We're going to talk about that today. What are the different care options available to you and your loved ones? Which option is most appropriate for your loved one? And what should you look for in a placement option, and what questions should you ask? But first, let's talk about when is it time to consider additional care? Good question, right? Well, for example, if your loved one is at home and you're seeing that they're beginning to fall a lot, that's a sign that additional care is necessary. Or if mobility is quite limited, for example, your loved one is maybe more sedentary these days and becoming more weak, and therefore mobility is a safety concern. Challenging and unsafe transfers, so getting on and off the commode, in and out of a chair, if that's unsafe and they need assistance, it's likely time for 24-hour care. Or if the caregiver themselves is stressed and burned out and their own health and welfare and safety is of concern. And if the cost of home care, which is a private caregiver coming into the home, is more costly than one can afford and then the budget permits. So, for example, as well, is when people are needing more assistance with activities of daily living. What are activities of daily living? Well, for example, personal hygiene and grooming, knowing when to brush one's own teeth, how to manage hearing aids, how to manage and clean, and the importance of taking out and cleaning, dentures, dressing and undressing if that's a safety concern, or dressing and undressing is just no longer happening because of cognitive impairment. That's of course a concern. Feeding issues. Sometimes people no longer really know when to eat a meal and time management is challenged. Transferring or moving on and off the chair like we just mentioned, or on and off the bed, on and off the commode, or instrumental activities of daily living, such as housekeeping, meal preparation. If meal preparation is not safe or someone is not able to ambulate safely in a kitchen, that's a problem, or knows, how to properly or improperly, or doesn't know how to properly use a stove, appliances, knives, things that are a safety concern, or if medication management or money management is of concern. Or anytime that dementia or more significant moderate dementia is present. For example, when things like bills aren't being paid, that's a function that's very important. And obviously if that can't be done, then maybe it's time to think of placement. Or poor hydration and nutrition or weight loss. Again, sometimes with cognitive impairment, people don't know even to hydrate, the importance of hydrating throughout the day or getting proper nutrition. If there are frequent UTIs due to that improper hydration, that's a good sign that there's more cognitive impairment than, one should have while living alone. Or if someone's sleep schedule is off, or there's a loss of sense of time, which we see a lot at Stellar. People no longer eating meals because they don't sleep properly. They don't then have a good next day. Depression or self-isolation. So if someone is no longer seeking social opportunities, because they're aware of their own cognitive impairment and they've become isolated because they don't want anyone to let on that they're dealing with cognitive impairment. That isolation can then cause oftentimes depression as well. Depression and dementia often go hand in hand. Or if someone's wandering, actively trying to leave the home, or is just so confused within the home that they may accidentally leave out the front door, that is a huge safety concern. Also, maybe there may be a fear of being alone. That fear is real and for those individuals. So sometimes that means living at home alone is not safe or appropriate. Or if there are behaviors, paranoia, or if the family is uncomfortable leaving the individual alone. What I always suggest is that you should really, as a family member, trust your instincts. If you're concerned about your loved one living independently, by all means, they're probably not safe. Listen to your intuition. So now I'll leave it to Marla to discuss the different types of care options.
Thank you. So the different options we will discuss today are long-term care, home care, independent living, large assisted living, residential assisted living, and memory care. The first option we're going to talk about is long-term care. Long-term care facilities are your traditional nursing home setting. I have spent 12 years of my career working in long-term nursing homes and will describe to you the typical capabilities of care that they can provide. This type of facility, there are registered nurses 24 hours a day, along with certified nursing assistants and a physician who is on call. This environment is for residents with high clinical needs that can only be managed by licensed medical staff. An example of the type of care that is provided in this setting is feeding tubes, Hoyer lifts, diabetic injections, colostomy care, and tracheostomy care. It is rare to have a private room when living in long-term care options. The majority of these facilities are designed to have 2 residents sharing a room and can have up to 4 people sharing the same bathroom. There is also a lack of privacy in this environment. You will almost never find the doors to these residents' rooms shut, and the reason for that is the nursing staff needs to be able to monitor these residents frequently due to their clinical needs. Long-term care facilities are certified to take Medicaid as a payment source, and the majority of residents who live in long-term care facilities are on Medicaid. However, if the individual makes too much money to qualify for Medicaid, then that person would be required to pay privately. The typical cost to live in a long-term care nursing home is $7,000 to $11,000 a month. Living in a long-term nursing home is only necessary when someone requires 24-hour care by a licensed medical professional. Next, we are going to discuss the difference between home health versus home care. It's really easy to confuse these two because their names are so similar. The best way to remember them is that one is medical care and the other is non-medical care. Home health care is provided by a licensed medical professional, such as a nurse, a physical and occupational therapist. This type of care is paid for by Medicare and Medicare Advantage health insurance and some Medicaid health plans. In order to receive home health care, the individual would need a referral from a doctor. Typical scenarios of recommendation for home health care is when a patient is being discharged home from a hospital or a skilled nursing rehab stay. Home health is a temporary service and is provided 2 to 3 days out of a week at 1 to 2 hours a day. This type of care is meant to help someone gain strength and get back to their prior level of functioning. Next is non-medical home care. Non-medical home care is focused more on assisting clients with regular daily activities that are needed to maintain their lifestyle, safety, and health. Caregivers help their clients with meal preparation, light housekeeping, transportation, showering, and using the bathroom. Since this service is considered non-medical, it is not covered by health insurance. However, long-term care policies can help cover the cost of non-medical home care. If someone doesn't have a long-term care policy and they are utilizing this service 24 hours a day, then their out-of-pocket costs can range from $15,000 to $17,000 a month. Our next option is independent or retirement communities. Independent communities are only appropriate for individuals who are high functioning physically and cognitively. If you are concerned about your loved one being home alone, then independent living is not an appropriate setting. The amenities that are provided in this setting include meals, housekeeping, and transportation. If residents in this setting are requiring assistance with personal care, then they are able to hire non-medical home care assistants like the option we just discussed. Independent living communities are not covered by any health insurance or long-term policies, and the average cost to live in this environment is $2,000 to $4,500 a month. Next, I'm going to let Wesley discuss large assisted living, residential assisted living, and memory care.
Hello guys, I'm Wesley Morrow, partner with Stellar Senior Housing Experts. Large assisted livings are social models that are non-medical. They provide 24-hour awake staff. The nursing is typically Monday through Friday, and they are on call 24/7. These large assisted livings can also assist with all ADLs. Meals, housekeeping are also provided. All the apartments are private. There's only a few that offer shared rooms, so you have a lot of privacy there. The care is paid for when needed, so it's based on time, a point system, case by case, or a la carte, and usually there's an additional cost for medication management. There are more potential for social connections available due to the large population. There are diverse activities generally throughout the day. They have exercise classes, music, different classes, arts and crafts, religious services, and activities provided off-site as well. They do trips to the museum, casinos, and plays. They also have their happy hour because it is a very social, large community. Transportation is provided to appointments, like your doctor's appointments, things like that, grocery stores, pharmacies, as well as banks. In-house in the large assisted livings, they have beauty shops, movie theaters, libraries, and like I was saying, the nurses are usually on site Monday through Friday. They don't have to be in the building 24/7, but they are on call 24/7. Also in these large assisted livings, you have the meal selection. So it's like restaurant dining. You have a menu, you sit down and you can pick from that menu what you would like. You have the leisure of an executive chef that can customize the menu based off of your needs. Whether you need a low sodium diet, things like that, they can monitor those in the larger assisted livings. So who are the large assisted livings great for? So it's great for those who are very social and extroverted, active, not likely to self-isolate. Because the larger assisted livings have a ratio of 1 to 15, you don't always get that interaction with the staff. So if you're someone or your loved one isolates a lot, or they're one of the people with a higher level of dementia that has depression, this wouldn't be the ideal setting for them because they are subject to self-isolate. Also here, you can take advantage of the social environment that's provided. Those with little to no dementia in the larger assisted living, they can go there and have a good social life. And they can also transition to memory care in some of the larger assisted living. Um, those that only need assistance with ADLs, so with there being 24-hour awake staff, you can get assistance with your ADLs, whether it be brushing your teeth, taking a shower, or going to the restroom. Along with large assisted livings, there's also the medium-sized facilities. The main difference is the care ratio. They still provide the activities and socialization like the larger assisted living, but the ratios are 1 to 10 or 1 to 8. The pricing with the medium-sized facilities are all-inclusive. So the only time the prices increased is the yearly cost of living increase. The next style of assisted living is your residential assisted living. These are small and intimate. Ratio of the caregiver are higher than the larger or medium assisted livings. There are fewer caregivers employed there, and so there's better continuity of care. So you're seeing familiar faces day to day. Some of the residential assisted livings are secured. Many are owned and operated by registered nurses. Activities are also often provided, but not always. It's really catered to who is in that residential living and what they like. There are home cooked meals, and the fees typically don't increase even when the care needs increase. So the residential assisted livings are great for those who are needing more home-like, intimate settings. Those that have significant memory impairment yet don't require memory care due to behaviors. Those that are near end of life and require a little more TLC. Those that require a higher level of care or acuity. And require assistance with most ADLs and cannot afford a large assisted living or memory care. Also, if they require assistance with most ADLs and would benefit from a higher level of care with the residential assisted living ratio. The next type of assisted living is memory care. And memory care is a secured environment, often has 24-hour nursing, engaging activities provided throughout the day. Caregiver to resident ratios are much higher. Greater oversight provided for residents to discourage isolation. Staff is dementia trained. Staff understands the disease and process of how to manage someone with behaviors and are trained to redirect. Memory care is ideal for those who are requiring a secure environment due to exit seeking or wandering tendencies. Individuals that require ongoing engagement and redirection. Those with significant and disruptive behaviors. Those requiring constant oversight. Individuals requiring nursing for medications or clinical needs. And also those that can't make their needs known. Someone that's not going to press a call button and ask for help when they need to go to the restroom, or even if they have an impulsive behavior and they like to get up every so often when they shouldn't be getting up because they're a higher fall risk. Memory care is great for people that are like that because of the closer ratios. So now I'm going to turn it over to our wonderful Corey Nelson. She's going to explain to you the pricing of each type of living.
Thank you, Wesley. Okay, so let's talk about pricing, because that's honestly, at the end of the day, kind of where we kind of have to start is cost in terms of ensuring long-term success and that one does not run out of resources. So as Marla was saying, in a long-term care or a nursing home environment, typically even for a shared room, the fees are anywhere from $7,000 to $11,000 a month. And obviously it's not often necessary, as Marla again was mentioning, because unless you need 24-hour nursing care, which is what makes it so expensive, it's not a necessary level of care typically. Home care is very costly because you're providing a caregiver, an individual, to come into the home on an hourly basis and with a local agency, which is what we would always recommend at Stellar, one that's licensed, bonded, and insured. You're going to pay anywhere from $20 to $25 an hour, which typically ends up being anywhere from $15,000 to $17,000 a month. Then there's independent living, which again is not usually appropriate for someone with any kind of cognitive impairment because it will often mean another move down the road. And long-term care is really the best in not having to make additional moves down the road. So, but independent living can be anywhere from $2,000 to $4,500 a month. And again, it's not really appropriate if you feel your loved one needs care. They don't typically get much care, if any, in independent living without paying additionally for home care services. Larger assisted livings for the cost of the apartment, which usually includes tax, transportation, meals, laundry, and housekeeping. Just for the apartment alone in a larger assisted living, it's anywhere from $2,500 a month to $6,500 a month just for that apartment, transportation, activities, and such. Then above and beyond that, you have to pay for the needs and the care of your loved one. So, and medication management as well on top of that. So that can be anywhere from $200 a month to $3,500 a month. As needs increase, so do fees. In a residential assisted living, as Wesley mentioned, their fees are typically all-inclusive and can start anywhere from about $2,500 a month in a licensed assisted living, all the way up to $5,500 to $5,600 a month in a licensed residential assisted living. And again, that includes all of the care costs. It will not increase over time. Memory care, and typically most memory care options are shared rooms, and those generally start at about $5,000 a month and go up to about $6,500 a month, possibly for a private room. Plus, then there's the additional cost of the care. There are typically levels of care, but medication management is typically included in those $5,000 to $6,500 fees, because it's kind of a given that if someone is requiring memory care, then they also need medication management. So what to consider when you're actually out there touring and shopping around at options? Well, the first thing I would say is only consider licensed options. Nursing homes are licensed. Larger assisted livings are licensed by the state of New Mexico. So are those medium-sized assisted livings that Wesley mentioned, for which there are only a handful in the Albuquerque metro area, and residential assisted livings. Those are all licensed assisted livings. They're all, except for the nursing homes, all of the assisted livings are licensed exactly like, well, they're all licensed the same. And they're also required to be licensed by the city. So the city comes in and inspects kitchens, and even the residential homes and the larger assisted livings. The fire departments scrutinize the assisted livings as well, and they're required to go through quarterly unbiased pharmacy audits to ensure that they're passing medications according to doctor's orders. The other thing to consider is, how are the caregivers engaging with the residents and guests when you're there on a tour? Are they engaging with the residents? Are they saying hi? Are they friendly? Are they kind? Are they snippy? All of those things you must consider, of course. Do the residents appear to be happy and clean and content? Do they have a good quality of life? Are the caregivers sensitive to privacy and dignity? So important, because you're going to, of course, want the best for your loved one. Is it clean? Does it smell of old set-in stains? It's one thing to, you must know when going to an assisted living or a nursing home that smells are going to happen. They happen. It's just a matter of, is that an old set-in stain where they don't care about cleanliness and they're not on top of it, or is it just a new smell that will go away very quickly. Are the meals appealing? It's a quality of life factor. You're going to want your loved one to have quality meals. And is programming provided? That's one thing that we think is very important at Stellar because it enhances anyone's quality of life to have opportunities to socialize besides just watching TV throughout the day. What questions should you ask when you're doing a tour of one of these options? Well, first and foremost, as we've talked about, cost is probably the hugest factor to consider. And what is the contract? What is the monthly cost? How are the additional, or are there additional costs for care? Is it just the cost, one cost and one cost only for the month, or will there be additional costs for care? And will those costs continue to increase as your loved one's needs increase? Is there a deposit or a community fee prior to admission? How do they manage providing care to all of the residents effectively? For example, what is their caregiver to resident ratio? What do they do in emergency situations? How do they deal with someone that's had an event? How high a level of care is actually provided by the assisted living? Can they care for your loved one through end of life? And how long have they been in business? And the last thing I'll end on is just the importance of being proactive. I can't say enough how important it is to trust your instincts. If you are concerned about the safety of your loved one when they're alone, trust your instincts. They're probably not safe. Don't wait until there's an emergency. We see it all of the time. There's so much that can be prevented, but people inevitably wait until there's an event. If you are the power of attorney, it's your obligation to ensure the safety of your loved one. They appointed you the power of attorney to be power of attorney in the event that they could no longer make decisions. And so if that time has come that they're not making good decisions, by all means, step in and ensure their safety. And placement can be the best thing for all involved. We see it all of the time. We help families find placement and they say, I wish we would have done this a long time. Why? Because it means that that caregiver can go back to their normal and original role of being the husband or the wife or the son or the daughter. So important. It can greatly improve everyone's quality of life, the caregiver and the loved one. It allows also professionals that understand best how to meet the needs of your loved ones. And it can allow for more appropriate and quality social and stimulating opportunities, which is so important in terms of keeping dementia at bay. And don't forget again that your loved one granted you authority as the power of attorney to make the best decisions for them when they're no longer able to do so for themselves. So just please, by all means, be proactive and utilize your community resources. Denise, thank you so much for having us today. We all appreciate the opportunity.
Of course, this has been super informational, even just for me. A couple of things that were mentioned in the chat room, and I noticed throughout the recording, the slides took a minute to pixelate. If possible, would you be able to email me these slides so I could share them with our participants? They were,
absolutely.
Yeah, this information was great. I do have a couple questions that maybe you guys can address. Typically, we get caregivers who may be in, without evaluating all of their options or going through individuals like yourselves who can help them make these well-informed decisions. You mentioned a lease. They end up maybe placing their loved one with a facility and then it wasn't the right fit and they need to move, or say with dementia during progressive, the progression of the disease, they need to move from maybe independent to a memory care or something. Is that something that's a really big issue as far as making those moves, or are they pretty seamless from your experience, or at least from what your knowledge is?
Yeah, great question. Yeah, from my experience, if we're placing someone, we try to get it right and make sure that they're able to stay in one place until end of life because movement is definitely hard on the actual resident. As far as the transition itself, it is a pretty easy move, depending on if they're moving buildings or just different wings of the place that they're at. Some places have independent living, assisted living, and memory care. If it's that, then it's really easy just to move to the other side of the building. If it is actually moving to a different community because they're unhappy, there is a 30-day notice that they have to give with assisted living. Sometimes in independent living, there's a 60-day notice. It just depends on what the contract that they sign entails. So it's very important that people read their contracts before signing with these facilities.
Sure, sure. And so another thing that I actually have encountered, and we'll open it up for other individuals. It looks like a few more people have joined us, so we'll explain how the question features the Q&A it works. But I have individuals who I know they're looking at facilities that are probably not the best fit, but are probably the most expensive, but looking at the progression of maybe a dementia individual, they're not going to take advantage of all of the programming and that sort of thing. Is there advice you have for caregivers who are placing their loved ones when it comes to what is realistic and what is the best or most cost efficient for your loved one?
Yeah, so I have a couple answers for that. So my bias answer is to use an agency like us, Stellar, because we take the sales feature out of the placement. Because their job is to sell you on their community when you're going to look at them. Our job is not to do that. Our job is to make sure you're finding long-term appropriate placement. So utilizing our service is really essential to them if they don't know the options in and out because we've been in every single one of them. We know what they can take care of. We know the levels of care that they have and the certain levels that they can't manage with their ratios, or if it's a larger community, if someone is starting to have dementia and they've had 4 falls in the last month or the last 2 months, you don't need to place someone into a larger place because those things are going to continue to happen because the oversight is not sufficient enough for them. Does that kind of answer your question?
Yep, absolutely. So if anybody else has any questions for Corey, Wesley, or Marla, you're welcome to unmute yourself if you feel more comfortable, opening up the discussion, or if you feel more comfortable typing into the chat room in the upper right-hand corner. If you hover your mouse, there's a little pop-out menu, and you can type in the chat feature. But they are open to questions right now if you have any questions regarding long-term care options or any of this presentation today.
Hello, this is Carolyn from Las Cruces, and just a question dealing with what I did with my mom a few years ago and other family members. What advice do you have for individuals where you have one family member who wishes or sees the need for their loved one to be housed in a facility, and then you have another family member who is putting their foot down, no, we're going to keep them at home?
That's a tough one. And if you ask me, that comes down to who's the power of attorney.
Got it.
And if there is a power of attorney that's been appointed and you're not both the power of attorney, it's the power of attorney's job to make those decisions. And that's why they were appointed, because yeah. Does that answer?
Yes, that's a good one, because in dealing with different families, it's like coming up, it's like, well, no, we said that we can keep them at home, but no, they need this type of facility, but no, we said we can keep them at home. It's like, okay, but that's good to look at the power of attorney and all of that it entails. So thank you very much for that. That helps.
Yeah, no problem.
And in my experience, this is Denise, Carolyn, that you often do have those individuals who are at conflict, but typically the power of attorney slash primary caregiver is aware of the need of care that's overlooked by other individuals that are not in that every day. And Wesley, I mentioned in the beginning, or maybe it was Corey, but they mentioned how many falls are we looking at? How many of the
Right.
ADLs or daily living, how are they impacted on a day-to-day basis? And so some of those need to sometimes be pointed out to those individuals who are not there on a day-to-day basis, or might be in denial of where the person that's in need of the care is at with their ADLs.
Exactly. Thank you very much.
Yeah, one more thing to add. This is Wesley. Never be scared to get the medical professionals involved, because it's much easier for them to be the bad guy versus you fighting with someone in your family and one of you guys being the bad guy.
Yeah, that's a great point, Wesley, is to put it on maybe the doctor's suggestion or their primary care physician, or even, some, if you have a professional in-home caregiver, that maybe feels like they need to be transitioned to a larger amount of care or more care throughout the day. So that's a great point, Wesley.
That's why I made him my partner. He's a smart guy.
Um, well, as I mentioned before, we'll try to I know there was some of glitches with the slides. I got an email that Blue Jeans was having some technical issues, so I hope that's not what prevented anybody from joining our group today, but I'll go ahead and look into it. I'm glad we're recording this session, so we can go ahead and share it with your networks as well as ours, Corey and Wesley and Marla. But because I think this is great information, especially for caregivers who are in this transitional period of do I need other care options, or so I think this is great. I will go ahead and stop recording if there's no other questions at this time.